Good morning. Welcome to the second in our series of COVID education webinars with RFABC and BCRPA in partnership. I'm Rebecca Tunnicliffe, CEO of BCRPA, and it's my pleasure to welcome Dale Miller, the Executive Director of the Lifesaving Society BC and Yukon. This is the big reveal, the launch of the National Guidelines, the BC specific version. So it's quite an honor for us to have Dale with us this morning to give us this fresh off the hopper yesterday. And with us from RFABC is Don Chow. You'll remember him from last week, ably monitoring the question period and helping with all other things related to RFABC. And Jewel is the BCRPA technical wizard who's here to help us with this webinar. And with that, I shall turn it over to Don.
Great, thanks, Rebecca. Welcome and thank you for making time available to be with us today. RFABC is happy to be partnering with BCRPA on this webinar. Welcome to Dale. It's been a few years since we've connected. So today I'll be moderating the questions as they come in and trying to group them as best as I can. And during the question period at the end, we'll have time for a few of the questions. However, I think Joel will cover the recording aspect of this session. So we're extremely happy to be here today. So Joel, do you want to go over some of the technical aspects of the session?
Thanks, Don, and thanks everyone for joining us today. It was so exciting to see this webinar fill up so quickly. So this morning, for the questions period in your GoToWebinar control panel, there's a questions box, questions area, and I see some of you guys have already figured out where that is. Please ask all your questions throughout this webinar there, and Don will address them at the very end. I also wanted to mention that everyone right now is on mute, so that's the only way that you could ask questions, and you can also let me know if you're having any technical issues. If you are having any technical difficulties with Wi-Fi specifically, there is a call-in option, and I will post that information in the chat box for you to see. And last but not least, this webinar is being recorded, so everyone will get a copy of this webinar. And so without further ado, I will pass it over to Dale.
Great, thanks very much, Jewel and Don and Rebecca. Great pleasure to be here with you today. I'm so glad to hear that this webinar filled up so quickly. There's obviously demand out there, and we know that. And we have been working hard on these guidelines. I know you probably wish you could have seen them a week or two or more ago as you're working on your own guidelines for your facilities. I wanted to start by certainly recognizing the people who have put time into these documents. It's a cross-country group of task forces, over 30 staff and volunteers from the Lifesaving Society from all provinces have contributed to this. And it's been a great collaboration. It's ongoing. The document that you will shortly get a link to on our website is a fluid document, very much. And so it's changing almost by the hour. So we will update it on our website. You can check back there regularly. We'll certainly provide you with the most recent version, and we'll make it clear that the date of that revision. So some incredible collaboration on this, and I want to make sure that you get the most out of it. So we're just going to go through our PowerPoint here and show you screens, right, Joel? We are freezing for some reason here.
Dale, you can try escaping and then reopening the whole webinar, the whole PowerPoint again. Oh, there we go. We see the next picture.
Oh.
Is it a picture that's supposed to be next?
There we go. Great.
Awesome.
All right. So that was a quick introduction to the document. The group across the country is continuing to work. There will be some additional documents that will be coming through. And as I say, we'll update the the full document. Now, if you see this on other Lifesaving Society branch websites, you may see several different documents. What we have compiled is one document, and with a table of contents that is searchable, so you can just click on whatever suits you best and your point of interest and go straight to that document, because it is a 60-page document. There's a lot of information there. I'm going to provide you with an overview and just some highlights today, because I should tell you to begin with that we did have a similar session with our members yesterday, and it was 2 hours long. And the first hour was presentation, and the second hour was Q&A, and certainly the Q&A probably could have gone on for at least another hour, and we'll be addressing a lot of those questions as we go through. But some great discussion, and I'll give you the high-level look at things today. So we're looking at recommendations for progressive reopening, recommendations for aquatic staff training. Of course, a very important part of this is first aid, resuscitation, and the personal protective equipment for staff. And then recommendations for cleaning, decontamination, and safe water management. There's also some excellent resources from WorkSafe BC that I'll point out, and some resuscitation and first aid recommendations, and then we'll move into questions. So just to preface, these guidelines have been developed to assist you to adapt your facility operation to mitigate the risk to staff and public health. And we know that all of you are at different stages of development with this. So some of you may be further along than others. We know that you've been working on this diligently yourselves within your communities. These guidelines are meant to assist you and support you, but we want to make sure that you do that through your own local filters. We have no enforcement authority through the Lifesaving Society, so these are our best practices and best recommendations from not only these people that I've mentioned from across the country, and you will see in the document that includes people like Dr. Steve Bierman, who you may have seen at some of the conferences, especially the Ripple Effects Conference. He's a local Nanaimo doctor who has been past president of the International Lifesaving Society, as well as Dr. Cody Dunn, who is on the early part of his career as a physician and very much an experienced lifeguard and national trainer for the Lifesaving Society. The data that you'll see reflects best available at the time, and as I said, it will be revised as we go. But we want to make sure that you understand that these do not replace or supersede your local and certainly any provincial or territorial regulations or directives from the provincial government and the provincial health officer who we see on the daily TV show. So that's just a preamble and a context to the full document. I'm going to start looking at the employee equipment then. That's the first section that we wanted to address. And that's something that we want to make sure that this equipment between staff, and we're talking mainly lifeguards here, is not shared. So typically in some cases you will have lifeguards sharing their what we call lifeguard toolkit, or that fanny pack with the first level of emergency equipment available on their hip. That cannot happen. Those need to be very individual and personalized now. So that's something to think about. And just things like cleaning clothes after shifts, changing clothes before and after their shift, things like that maybe is definitely new measures for your staff. So that kind of employee equipment considerations. Employee PPE, this is a very important part of what we want to discuss today. And again, we want to make sure that staff are avoiding the sharing of those items. But we need to make sure that they are equipped with the proper PPE, and we will, through the society, I'll talk a little bit later about how we can help provide that for you. You already purchased probably some of your equipment from us, so we're sourcing some of that out for you with the enhanced requirements for PPE for your staff. One of the recommendations we're making, though, is that you have one first aid responder equipped with a more robust PPE equipment. So gown, visor, the full 9 yards, just to prevent undue delays in responding to first aid or resuscitation requirements that might be caused by needing to put the PPE on. So a number of things like that. We'll talk about pocket masks as well as bag valve mask, the BVM. That will be an enhanced measure that lifeguards will need to be using. So there's a little additional training that needs to be done, and we'll talk more about that in a minute as well. Facility admission and access. Certainly, you've probably already thought of this. Things like entrance signs and some signage to indicate to patrons that they should not be entering if they have COVID-19 or are suspected of having any COVID-19 symptoms. And of course, the physical distancing requirements, lots of signage to that effect. The need for them to be washing their hands. And of course, I'm sure you've already thought of this, the increased need for those hand washing stations within your facilities. I should back up a minute here too and just say that at this point, we're really only considering outdoor pool and indoor pool, outdoor pool and waterfront opening within the next short while here. And this is something, again, that you may be doing differently within your community, but chances are that it will be gradual reopening, and the indoor pools will come after the outdoor pools and the waterfronts as well. Other signage that needs to be there is things like the layout plan. If you have some circulation path around the pool to help enforce the physical distancing, that'll be important to have on signage as people enter your facility. And also just making sure that there's minimal contact between employees and patrons. And again, as we've seen at so many retail outlets and other locations, that plexiglass barrier that will assist with that minimal contact between your employees and patrons. Some kind of reservation system is also something you might consider. If it's a gradual reopening of your facility, and let's say it's lap swimmers first, or clubs and rentals, then you would want to make sure that there's some kind of a reservation system in place. And I'll show you a good sample of that a little bit later. We're also looking at, communicating physical distancing. I mentioned aquatic facility amenities as well. Those kinds of things that that we see in the pools through different types of play features, all kinds of things like that you need to be aware of. Things like diving boards, water slides, and rope swings. Rope swings are presented a higher transmission risk, and probably in the gradual reopening, you want to prohibit the use of them in early phases of reopening, and that's mainly because of those common touch points and the difficulty of certain cleaning a rope swing between uses. Things like diving boards, water slides, making sure that those have some markings ahead of them to allow people to line up with, respecting physical distance measures, those types of things as well. So now, water playgrounds and splash pads. This is a bit of an interesting topic here because some would say that they're outdoors as long as physical distancing is enforced. There's really no problem in opening those up in the next phase here. The concern there, of course, is that in most cases, those water playgrounds use untreated water, whereas in your outdoor pools and certainly eventually your indoor pools, they are using treated water. And so far the evidence has shown that chlorinated water does not allow the transmission of COVID-19. So that's something to consider. We're suggesting that they not be opened in the first phase, mainly because of that untreated water factor. One of the things we've put in these guidelines throughout, and there is some repetition, but that's intentional, because if you jump to one section, we want to make sure that you still see caveats like this one. Operate water playgrounds only while there's no ongoing community spread of COVID-19 in your region, in accordance with provincial health authority recommendations. So that seems like a given, but we want to make sure that that's part of this document, so you're seeing that as well. So lots of things like that that need to be considered. As far as programming aquatic facilities, again, signage being very important. Ensuring that the bathers are not using or sharing their water bottles, towels, goggles, or any other equipment with those other than maybe family members or household members that they arrive at the facility with. The other interesting thing here too is that we're recommending that snorkels not be allowed if you do use them or allow them typically in your facilities, because of the aeration of the water that can be done with snorkels. That is being suggested to be prohibited as well, even though again it is chlorinated water. If you supply personal flotation devices to your users, be aware that they need to be disinfected between each use. So again, you know, as with many of these measures, you may need to consider increased staffing, and I'm sure you've already looked at that. For each of these concepts, of course, you need to prepare a plan for them, and part of that plan, of course, will be reduced bather loads, just to allow for physical distancing. Within this document, once you see it on page 12, there is actually a calculation there that's going to hopefully assist you in determining what your modified bather load might be. And there was a little confusion in the call yesterday. People felt that the suggestion of 7 meters squared of water surface was that physical distancing of 7 meters between people. Not at all. This is just meant to be an initial calculation to give you an idea of what that space might be able to accommodate as far as patrons, whether it's your natatorium, your actual pool area, your change rooms, your lobbies, any part of your facility. There is a calculation there. And actually in one of the appendices later on, there is a calculation for different types of uses of your facility as well, whether it's lap swimming, other classes, whatever it might be that you move into at a later date. So there's a number of appendices there and some models. And as always with those models, they are just that. They are not meant to be recommendations. They are just samples for you to consider. One of them actually on page 19 has a number of phases of suggested phases of reopening your facilities. We've added a note at the bottom that these suggested phases do not necessarily correlate with the provincial health authority plan phases. You've probably all seen Restart BC, the provincial government document with its phases. The phases in this particular appendix are not meant to correlate with that, so please don't try to match that up with the Restart BC document. So key messages, certainly from a staff training point of view, we want to make sure that after prolonged absence from work, that your aquatic staff are ready to provide effective safety supervision to the members of your public. And of course, they need to have some new protocols in place. And these protocols will be part of this document that you will see. And it's something that obviously is put in place. And again, it's considered best practice at this point. I should mention too that the information here has come both from expert opinion of those over 30 staff and volunteers across the country, but also in consulting a wide number of documents that we've seen both within Canada and globally as well. And I'm sure you've sourced some of those as well. So those are links and documents that can provide some excellent information. One of the better ones I've seen is from actually the Italian Swimming Federation. They have put in some excellent guidelines there. Our Royal Lifesaving Society in Australia has also put out an excellent document. There's a number of those, and we're seeing so many of them. I think what we will do on our website is provide links to all of those so that you can go to them and as with this document, just glean the nuggets that are going to assist you in producing the best available process and plans for your facilities. And I should mention too that on our website, if you go to lifesaving.bc.ca homepage, there is a document, a link there to a page that has all of our updates related to COVID, some changes in our program launches, of course, due to the delays caused by COVID-19, as well as this document. So if you're on the website now and you're seeing that document, you can certainly follow along. There's a link there. And I should mention, Rebecca had asked earlier that we have updated it this morning already. So the latest one will be up on the website as we speak. So there have been a few changes even since yesterday. So the new protocols, things like the training plans to reactivate returning staff. This is going to be very important, and we want to make sure that the staff are ready. I'll talk a little bit later about how we can support you in that, but certainly developing a recertification schedule at some point, and very important to document all training. And you know, unfortunately, there will be a lot more documentation required. We see even with the opening of restaurants yesterday that they're required to have their patrons provide their contact information so that if an outbreak does occur, there can be some contact made and some communication as to next steps. So those are, you know, we saw excellent numbers from Dr. Bonnie Henry yesterday, but there's always that possibility of a community outbreak, and if that's the case, we know that things will change very quickly. Adapted protocols, we know that there will be some facility safety plans that need to change. Your disinfection protocols will need to change. We've talked about the facility amendments. Your program schedules may change as well, and you've probably already considered this. Some will reduce hours, and in fact, some have talked about increasing hours because that will accommodate more of their patrons, because we know that there will be less of them in the pool at any one time. So, and this is something that actually came out of the survey that we did about a month ago that many of you would have participated in. We talked about the physical distancing as well. Safety education and rule enforcement practices, that's something that's going to be different for your staff as well. And again, just the importance of the physical distancing requirements and the importance of that signage as they enter, but also communicating some of that safety education and rule enforcement with other sources. So things like your website, social media, those kinds of things that need to help to provide information to your patrons prior to them arriving at your facility. One of the things that we've developed too is what we call a rescue ready assessment. So that's something that we want to make sure, you know, as we move forward here, we know that, you know, lifeguards face a decision about how to balance their own safety with providing life-saving care. And you as the employers, of course, need to help guide them with that. And of course, provide the appropriate PPE as well. We have a number of things that we want to ensure that we would suggest that you minimize the number of people in direct contact with the victim, so the number of rescuers. We have in this document, page 30 shows in order of preference what would be the treatment levels. So first would be that bag valve mask I mentioned, the BVM. If not available, then the viral filters. And these are filters that need to be added to current face masks, pocket masks, and the BVMs. BVMs, as I mentioned, are going to be an additional piece of information that staff will need to be trained on. So that's something that's coming as well. This rescue ready assessment is certainly not meant to replace the National Lifeguard or First Aid recertification courses. That information still stands. There will certainly be some enhancements to it, but things like if you're on the document, page 36 shows the pool sample assessment that you could use. And it talks about it. There certainly are some elements there of a National Lifeguard recertification, but it's certainly not meant to be a full recertification. This is just meant to ensure that your staff are ready to perform at the level that they're expected to perform at, with, of course, modified protocols. And this is something that needs to be recorded as well. Make sure that you're recording it. If you don't already with your in-service training, record who has and who has not taken that training. And of course, if there's some less than satisfactory performance, as with any type of training, that needs to be remedied before those people are put on deck. So that kind of information. And then for those of you that are operating waterfronts with lifeguards, unfortunately, very few of those in our province, and page 37 provides a sample assessment for those staff. So that's the rescue ready assessment. Within that, there are a number of appendices for you that provide a little bit more detail and show you some of the things that are very important for you to ensure that your staff are adhering to. Within that document too, there is a decision tree, and these are just a couple of reminders, just preparing a plan to manage a possible outbreak in your facility, as I mentioned, and a check-in and check-out for staff and patrons, so that contact tracing can occur if an outbreak does happen. So some of the PPE that we talked about, I've mentioned most of these. The viral filter will need to be added. And some of you may be familiar with the term HEPA. That is another type of filter, and the viral filters are, I believe the HEPA is 99.9% filtration rate, whereas the viral filters are 99.7%. So we will be providing those viral filters to be added to existing pocket masks, as well as if you purchase other pocket masks from us, they will of course have an increased price, unfortunately, because there will now be a viral filter attached to that. And of course the BVMs, gloves, face shields, surgical masks, gowns, all of those things are things that we are sourcing for you to provide. We have staff working on that, and so the shop at lifesaving.bc.ca will provide a fair bit of that information for you. One of the neat things, if you saw on a global news story a couple of weeks ago now, there's a local company who has produced the cap shield that you see on the right-hand side of the screen. So instead of the full face shield, this is one that can be attached to a ball cap. And of course, we've attached it to a National Lifeguard ball cap here that's available from us as well. But these are quite handy, especially when you know, lifeguards at outdoor pools and waterfronts especially will likely be wearing a ball cap. So this is an easy add-on to that, and you can order those from us as well. We've already got those in stock. So cleaning, contamination, and water safety, safe water management as well. This is something that is critical, the personal protection. You've got things there that talk about protection of staff responsible for cleaning aquatic facilities. So far, we've talked mainly about lifeguards, but the cleaning staff as well need to fully be protected, of course, with adequate PPE, enforcing personal hand hygiene, things like that are very important. Also information on where to clean, common contact areas, of course, and again, this needs to be part of your plan. One of the things, actually, when I mentioned the plan that we have talked to the Ministry of Health about is your current pool safety plan. It would be simplest to add a new chapter to that, and they're quite open to that. And instead of going through your full document and adjusting accordingly, that you have a separate chapter related to COVID-19 plans. Certainly, if they contradict anything in the other part of your plan, you'll need to go back and make those adjustments. But having said that, I should also mention that this document that you're now seeing will be going to the provincial government as well as your regional health authorities. We've had contact with them already, told them it's coming. We've had some great feedback from them saying they appreciate that support that we're providing to your aquatic facilities, because some of them are not necessarily experts in aquatics. So that's where we can help support you as your local expert in aquatics and make sure that we're following all of the guidelines. Safe water management, things like ensuring that water testing takes place as required by regulation, and that you meet or exceed the requirement by regulation and guidelines. And there's really no need and no evidence to support the need for increased disinfection of your pool water because of COVID-19. If you're maintaining proper levels as per the guidelines and as per what you normally do anyway, then that should really prevent the transmission of COVID-19 through pool water. So that's safe water management. There's also a document through WorkSafe BC. And as you have heard through Dr. Bonnie Henry, there is a need to have industry-specific guidelines for the WorkSafe or workplace safety plans. So there's an excellent document on the WorkSafe BC website, and it is a template that you can follow. It lists 6 different steps that you see there, and many of these you will probably already have done. Maybe you've already accessed this document and you're way ahead of the game, which is excellent. But step 1, of course, being to assess those risks, implement protocols to reduce them, develop relevant policies, and of course communicate the plans and the training for staff. And once that is all done, of course, monitoring your workplace on an ongoing basis and updating those plans as necessary, and assessing and addressing any risks from resuming your operations. One of the things in that document, of course, as you've probably already done, is involving your Joint Health and Safety Committee as well. So those are the 6 steps within that WorkSafe plan, and they talk about involving frontline workers, reviewing industry-specific protocols, which is that document that we're providing you with. So a number of things to be aware of there. One of the things that they use too is the 4 levels of protection. And so first, of course, being elimination, things like limiting the number of workers in one place with physical distancing, and those engineering controls, the plexiglass barriers, administrative controls, rules, guidelines, things like that. And of course, the PPE that we've talked about a fair bit. One of the things they have mentioned, and again, if you've seen some of the news coverage recently with the WorkSafe head of prevention services, Al Johnson, he has said that WorkSafe will not be reviewing or approving plans of individual employers, but during a WorkSafe inspection, they'll be asking employers about steps they have taken to protect their workers. And so, of course, with the overwhelming demand that all of this restart will be creating, for the most part, it will be based on what they see in their inspections, and very much complaint based as well. So if some of your workers, or in fact your patrons, feel that you're not following good safe working guidelines or safe operating guidelines, then they will likely report that either to WorkSafe BC or the Medical Health Office, and that's where you will likely get a visit from an inspector or some questions asked. So excellent document from WorkSafe there for you to reference as well, if you haven't already.
Hey, Dale, just hopping in real quick. There's a 10-minute warning.
Great, thank you very much. This is a sample from Jericho Tennis Club. This is just a sample of something that they have put on their website to their members. Booking a lane 3 days in advance. This is for their lap swimmers. They use a piece of software known as Game Time that you may be familiar with, or you may have your own already in place. Swim lanes are 45-minute bookings, 3 numbered chairs on the south end of the pool to place your belongings. And I should mention too that there has been discussion about whether change rooms should be open or not. There is the thought that you ask your patrons to shower before they come to your facility. They come in and leave, and they have that booked time. They don't access a change room, they don't access a shower. And again, this is reducing the potential for transmission of COVID-19. So this is the kind of sample that you would see. And of course, Jericho's got a beautiful background, not such nice weather when this shot was taken. But they've numbered the lanes. So they, as I've said, they've got chairs at the end of the lanes for the people to put their belongings on, and limiting numbers as well. So that's the sample there, and I'm sure that you've looked at doing very similar things. Moving on to resuscitation first aid recommendations. So this is the information bulletin. As I mentioned, this is the kind of document you may see through other branches. We have pulled all the information from these disparate information bulletins and put them in one 60-page document for you. So it should all be there for you, similar to what you see in other documents. These recommendations, of course, recognize 3 factors: additional risks to lifeguards, as I mentioned. One size fits all solution is not there. We manage the new issue and approach it from a principle perspective, which is something that we've done all along with lifeguard training. There are no prescriptive step-by-step procedures. It's very principle-based. Obviously, those principles will change based on COVID-19 protocols. And also just mitigating the risk of disease transmission and making sure that we provide those supplemental considerations as well. One of the considerations, of course, now many first aid training agencies are moving to compression-only resuscitation model. Knowing that drowning is a hypoxic event, that we need to consider that. And so there are cases where the rescue breaths will be required. And so that's where that PPE comes in very importantly, and of course the enhanced training as well. There'll be modified rescue processes, identification of a high and low risk treatment, and I'll show you a chart in just a minute that emphasizes that. PPE we have talked about, and of course cleaning and storing PPE adequately as well will be very important. I think in the interest of time, I'll move on. I think I've mentioned most of this. Identification of high and low risk. Some of the high risk treatments that do generate aerosol, which is the risk, are things like chest compressions, ventilations, high flow oxygen, more than 5 liters per minute. Any suction that's done will create that aerosol, and also abdominal thrusts and back blows. And each of these, of course, has assigned PPE as well. So there's the chart that I mentioned. This is in your document as well, Appendix E, lifeguard personal protective equipment. You may not be able to see it too well there, but you can refer to the document there. And of course, on the left-hand side, you've got the no contact version, and then the direct contact. Within direct contact, of course, low risk and high risk. So you've got some recommended PPE for each one of those, and making sure that your staff are well protected. This is also something to help your staff, and as I said, not meant to be very prescriptive, but this gives them a decision tree for first aid and resuscitation. And I'm not going to go through each step here, but this is something that will be an important part of your retraining of staff as they come back on board. So those are charts that you will find in your document. I've mentioned the types of viral filters as well, adjustment to pool safety plans, things like surgical masks and gloves being in zip top plastic bags within the fanny packs, and a dry container that will have enough PPE for 2 rescuers, the victim, and a bystander. And this is what we mentioned before as a more robust version of the PPE that will be needed for those staff that are available to rescue. And so that affiliate training support that I mentioned, obviously we give you all of these recommendations and say retrain your staff. Here's how the Lifesaving Society is looking to support that within your communities. We're going to be providing an in-service outline. It'll be a mixture of blended and in-person training, and include the list of documents your staff will need. I need to give a major shout out at this point to 2 of our staff members, Cheryl Savani, our manager of safety services and sport, and Brooke Sherfis, our education director. They have been on these national task forces, in fact, leading them. And so we have some excellent in-house experts here within our branch that are working hard to provide this kind of support for you, that in-service outline. Brooke's working on it as we speak across the room from me here. She will be available later if there's any very technical questions. And also developing skills videos and evaluation criteria for things like the BVM use, which is new, and modified rescue processes. Obviously, to train your staff and within your facilities, if you have Lifesaving Society trainers or National Lifeguard instructors or first aid instructors, there will be a virtual model to allow them to learn the skills and how best to teach them to your lifeguards. So that's really a quick overview of the document that we're providing on the website there. As I said, check back. It will change, hopefully not daily, but we will keep it updated as much as we can for you. I'm going to turn it back to Dawn and take a drink of water.
Thanks, Dale. Thanks, Dale. Very, very informative. I think there's lots to learn there. So you mentioned at the end about keeping in touch with the website. So the first question that I've got is, I guess it's a bit of a living document, and the group was wondering what the process for communication of updates or summary of the manual might be for the audience.
Yeah, good question. I mean, if there's some major changes, for instance, there are a couple of appendices that are not there in the current document. They're being worked on and probably will be available the next couple of days. But those are ones that we thought were next phase. So things like getting programs back into your facilities. We know that the first stage will be public swims. So programs will come later. So we thought, let's get this document out. Everybody's waiting for it. So that went out yesterday, and the appendices related to programming. And actually the second one is related to life-saving sport, if you're doing that within your facility as well. They will come probably by the end of this week as far as notification for that. If there are major changes or additions to the document, then certainly we'll notify for BCRPA members. We'll notify Rebecca so a notice can go out to you in her regular updates to you. And of course, we'll do the same for your colleagues who are our members as well. So of course, you can always check back to the website on an ongoing basis as well, but we will provide those updates as well as what changes there have been to the document.
Great, thank you. On page 11, people are looking for clarification on the water playgrounds. there's a reference to only while no ongoing spread of COVID is happening in the area. So I guess it's a question of, if there is no ongoing spread, can water playgrounds open, or do they have to wait for the later phases?
No, that's a great question, and I think, you know, as I've said to begin with, it's important to know that you're going to put this through your own community filters. We're not saying do not open them if you have all the measures in place. And, you know, these water playgrounds, of course, are fun places for the young kids, often tough to ensure physical distancing for them as they're running around that water playground. There's even a suggestion that you need to put a fence around the water playground. I'm thinking of the one in Rocky Point Park in Port Moody. You know, fencing around that just to be able to control the access in and out of those water playgrounds, and ensure that you're making the or meeting the numbers that you've decided are best. So again, these are guidelines. Some of these questions are excellent, and as we provide this information to our regional and provincial health authorities, we'll add those questions in. One of the other things that came up yesterday, I should mention, is so in proper safe water management, and in fact, I believe even in the provincial swimming pool regulation, there's a requirement for patrons to have a shower before they enter the pool. If we're closing change rooms and shower rooms, that's impossible. Are the authorities comfortable with that in this case? So that's, again, a real good question, and we'll be posing those to our authorities.
Great. There was actually a fair bit of interest on the water playground side. So is water from the municipality, which is treated, considered to be sanitized? Sanitary?
Yeah. Not to the level, of course, of a swimming pool. So when you're looking at the levels of free available chlorine and in some cases bromine, we know that the municipal supply is not going to provide that level. And it's that level that has been, evidence so far has shown that does not allow transmission of COVID-19.
Okay, good. You mentioned about personal protection equipment. A piece of equipment came up on the questions about handheld radios, and that's something that is shared between staff. Is there an issue with handheld radios being shared and possibly sanitized in between staff members?
Yeah, absolutely sanitized between uses. And I mean, whether it's a plastic bag covering that goes over it that gets changed after and before each use, that's one method of doing it as well. But yeah, absolutely not handing them from one staff member to another as we normally would have. I mean, even things like rotation of lifeguards to and from a lifeguard chair, those lifeguard chair railings really need to be disinfected between uses of lifeguards. So there's so many new things that we have to consider with these protocols.
Okay. Do you have any suggestions on physical distance signage?
Yeah, we have seen some that is excellent. I think it's very simple. It depends what part of your facility that you're thinking of. I think certainly as we see, you know, as we enter different retail and other locations, you will see that sign that has the arrows, the person in the middle and the arrows on either side. And as people enter your facility, that's an excellent reminder for them. If they're entering a change room, again, signage at that point would be very important. Use of lockers is another thing to consider. You know, the lockers are side by side, and so the use of every one of those lockers is just not going to be possible in the first phases of COVID protocols here.
Okay, great. And also there was a question about first aid protocols and expected PPE. Where can the audience go to get additional information about that.
Sure. So I mentioned that we have the e-commerce on our website, lifesaving.bc.ca, and you click on the shop. It's not there yet, so don't go quite yet. But we're working on it today, and certainly we have been over the last couple of weeks trying to source that with our typical first aid suppliers. So I did mention that we do have the cap shields in place as well. So those are available now. We have lots of the fanny packs and lifeguard toolkits. We don't yet have the viral filters for the pocket masks that you would typically purchase for us. So we won't be sending out any of those pocket masks until we have those viral filters available. But again, we have ordered them and we hope to see them within the next week. So we'll have that information as quick as we can.
Great. Thanks, Dale. That's all the time we have for questions. I'll turn it over to Rebecca for wind up.
Thank you. Thanks, Don, for fielding the questions. And Dale, this presentation really shows the enormous amount of work that you've been coordinating nationally and for us in BC. We so appreciate it. And you're right, it's been long awaited and it's well worth the wait because it's just so well put together. We're putting ours together and presenting it to the province today. And a lot of what's reflected in yours is also reflected in ours. So members can rest assured that we're all on the same page and working together. And we really appreciate your time today, and we'll continue to watch your website for updates and stay connected. We really have valued our partnership in the last few months as we've been discussing the impact on our sector for COVID. So thank you. And to the members of the audience, we will be providing the slides and the recording to you. We'll also be circulating to both our memberships, RFABC and BCRPA, in upcoming emails so that everyone who wasn't able to attend today has access to this very rich information. And we'll see, we're planning another webinar for a few weeks from now, which may also be related to some of the other considerations you have with opening your pool. So stay tuned for that. Thank you for attending. Bye-bye.
Thanks, Rebecca.